Hi friends, today's video is going to be on Domel. Domel has Domperidone in it. This is 60 ml syrup of Domperidone. It's made by Barrett Hudson and the price for one bottle is 61 rupees. Domperidone is an anti-sickness medicine. It helps you to stop feeling or being sick, which is nausea or vomiting. It can be used to treat stomach pain if you are having end-of-life care, palliative care. Domperidone is sometimes used to increase milk supply. Your doctor may prescribe it if you're having trouble breastfeeding, but only if other things have not worked. Domperidone comes as a tablet or as a liquid that you can swallow. It is available on prescription only. This one is a syrup. You usually take Domperidone when you need it up to 3 times a day. It works best if you take it before meals. The most common side effect of Domperidone is a dry mouth. It is generally prescribed for a short time only, usually up to 1 week. Domperidone can be taken by most adults and children aged 12 years and older. It is sometimes prescribed for babies and younger children by a specialist doctor. Domperidone is not suitable for some people. Always follow a doctor's instruction when taking Domperidone. Take it when you need it to help with your symptoms. It's best to have Domperidone before food. Take it 15 to 30 minutes before you have a meal or a snack. The usual dosage for adults and children aged 12 years and older is 1 10 milligrams tablet or 10 milliliter of the liquid. You can take Domperidone up to 3 times a day if you need it. Space doses evenly throughout the day, at least 8 hours apart. If you forget to take Domperidone, take it as soon as you remember. If it's almost time for the next dose, skip the missed dose and take the next one at the usual time. Never take 2 doses at the same time. Do not take a double dose to make up for a forgotten one. Taking too much Domperidone can be dangerous. Like all medicines, Domperidone can cause side effects, although not everyone gets them. If you get any serious side effects, tell your doctor straight away. I hope you like the video. Please like and share our channel, subscribe to our channel. Domperidone is not usually recommended in pregnancy and breastfeeding. Domperidone is not usually recommended when breastfeeding, as it passes into breast milk in small amounts. Talk to a doctor or other medicines, as other medicines might be better. Domperidone is sometimes used to increase milk supply. However, there is some evidence that it can give a baby an irregular heartbeat. Talk to a doctor about the benefits and possible risks of taking Domperidone when breastfeeding. I hope you like the video. Please like and share our channel, subscribe to our channel. Thank you.